This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo! Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. Speaking of Pets podcast is sponsored by Vetramax Solvacare Gel, the industry-leading treatment for idiopathic hyperkeratosis. Available from your vet or visit Chewy.com and save 15% with promo code VETRAMAX15 at checkout. Vetramax makes it better. And Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Hey everyone. Welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist, and
I'm the doctor's sister. I'm Janet Novotny-King of Cleveland, Ohio. We both were born and raised there, and we're proud Ohioans. And today, Alice, who do we have joining us?
I have been looking forward to this. We have Dr. Gerald Post, who is a board-certified veterinary oncologist and founder of the Animal Cancer Foundation, as well as chief medical officer of PhytoCure, both of which I'm dying to ask him about. Because when I went online yesterday and the day before, they have some wonderful webinars there about the projects that they're funding and what's going on between comparative oncology or cancer between humans and our pets. And I'm so glad that in this society, we're marrying the two because we can learn from each other. Yep. And then we also have Barbara Cohen, who is the executive director of the Animal Cancer Foundation and a fellow golden retriever lover. 100%. And if I'm not mistaken, Barbara has devoted her life to the Animal Cancer Foundation because sadly, like the rest of us, she has lost some pets to cancer, and it puts us all on a mission. I can't thank Dr. Post and Barbara enough for what they're doing because I think it is so vital to marry the knowledge between what's going on in human oncology and veterinary oncology so we can learn from each other and get this thing solved if it's all possible to do that. So welcome, Dr. Post, and welcome, Barbara. So happy to have you with us today.
Thank you so much for inviting us.
Oh, yeah, we're delighted to be here with both of you.
Well, Dr. Post, I'm going to start with you because we have, as we were discussing, a lot of, and I don't want to start reminiscing about all the people we have in common that we know, and also a neighborhood that you and Janet have in common in Connecticut. But please tell us the story of how you established the Animal Cancer Foundation, because I read a little bit about that, and it's very touching.
Well, thank you. So I did my residency in oncology at the Animal Medical Center in New York. And really just a couple of streets away was Memorial Sloan Kettering Human Cancer Center. And I was able to spend a day a week at Memorial Sloan Kettering. And I really saw firsthand how my patients and their patients were quite similar, both in the types of cancers that they got, their responses to therapy, the toxicities, and the hurdles that were involved in both treating cancer in animals and the hurdles that were involved in treating cancer in people. And it was right at that time that the whole field of comparative oncology was kind of gaining steam. And I saw that comparative oncology research was being funded at different universities, Colorado, Davis, Cornell. But I also saw that more and more of my fellow oncologists were starting to go into private practice. And nobody was raising money for research outside of the university, outside of those silos. And so that's when I decided to start Animal Cancer Foundation as a way to raise money for cancer research, outside of universities, because, there was in my opinion, going to be a large influx of oncologists into private practice. And I also saw that there was a great deal that we could learn from each other. In other words, what veterinary oncologists could learn from human oncologists, and also what human oncologists could learn from veterinary oncologists, because there were things that veterinary oncology could do that you just couldn't do in human oncology. And human oncology had decades more experience with many types of diagnostics and therapeutics that we could learn from. So that's why I started.
Walked in the room. I just saw 4 paws walk in.
That is Henry, my younger of 2 French bulldogs, and lights of my life.
So I'm assuming the Animal Cancer Foundation is a nonprofit, right?
It is.
That is correct. 501c3.
Now so you're talking Janet's language.
Yeah, I just retired as an ED from a nonprofit. So, Barbara, how do you raise money, and like what percentage is it from corporate donations? Is it individuals? And if I'm a donor, what's in it for me?
Okay, so we know that Americans are very, very generous people, right?
Yeah.
And that an enormous amount of charitable giving comes from individuals.
Yep.
And like most charities, we really depend on those individuals to fund comparative oncology research. Yep. And what I like to tell people is that when they sort of enter this area or enter the building, so to speak, we're usually not here because we're joyous to be here, right? We usually have had an experience of cancer in our pet. We want other pets and our own pets to do better and better fighting against cancer. Yeah. And so individuals are, and particularly pet owners, are very forward thinking about what they want to do to help other pets. Yeah. And they're very generous about giving. And they give, when I say individuals, you'll know, Janet, that individuals, sure, they give by writing a check or making a donation by credit card, but more and more they're looking at their donor advised funds. Yep. Or making stock donations or thinking about legacy donations to an organization that can really power up an organization's mission. That having been said, there are very generous corporate sponsors who have helped us over the years, who have gotten involved with us as commercial co-venturers, who have helped us run events, who have sponsored events. Particularly Blue Buffalo Foundation has been incredibly generous because we share so much mission alignment. Right. The one area we do not take is government funds. Yeah. And that's a whole other
can of worms.
It sure is. And we've always wanted to be able to be very responsive and very fluid so that we weren't a big institutional funder that would get bogged down in a lot of material and then not be able to fund that thing that was most promising. And so these are very deliberate choices.
So the history of the organization, when did it start? How long have you been around? How many are on your board? Can you tell our listeners a little bit more about that?
Can. So Dr. Post started the organization in 1999 in California. And he can tell you better because it was a bequest from his grandparents.
Oh, cool.
I love that.
That's amazing.
So my grandparents were just angels on earth. And their spirit of really, my grandmother died from metastatic colon cancer at a young age of 70. But they were taught me just love and respect of all things, human and animal. And so, when I saw the value of comparative oncology, that it was not just a new tool in the box to treat cancer, but a completely new toolbox itself. Mm-hmm. In other words, I really believed and still even more strongly believe now that comparative oncology is a very underutilized toolbox in the fight against cancer, whether it be human or animal, and that the things that we can do with animal cancer and human cancer can help each other. And I want to really stress that when I talk about, cancer research, I'm really talking about helping dogs and cats with cancer, not doing research on them, but doing research for them. Again, what Barbara and I have, really talked a lot about is there's enough cancer in dogs and cats around that we don't have to induce cancer in them. And that's a big thing for me as a veterinarian, as an animal lover. We never induce cancer. There's plenty of cancer going around. There's, 6 million new cases of dog and cat cancer per year. So it's quite high. And so, why not study naturally occurring cancers? Because by and large, they're a far better model of how cancer works in people, because you know what? Cancer is naturally occurring in people.
Mm-hmm.
I'm not saying that the current mice and rat model aren't valuable, but they're not as predictive as naturally occurring models in how cancer is going to behave, how therapeutic interventions are going to happen. And, when you really look at it, the dog and the cat are really the only animals on the planet that get cancer at a high enough frequency, that are treated frequently enough that we can use as a reliable model for human cancer. And so why not use comparative oncology to help both pets and people?
So do you have some success stories in the comparative oncology world with, pets and humans that have worked?
Yeah, so there are a number of chemotherapy drugs, small molecule inhibitors that would never have seen the light of day if it weren't that they were tested in dogs and shown to be effective. And in many cases, the fact that they were tested in dogs really predicted that they were going to be successful in people.
Wow.
One of which was a drug my dad was on.
Mm-hmm.
He developed cancer, and one of the drugs that was originally tested in dogs and then moved on to humans kept him alive for almost a decade. So the story is not just scientific, it's personal. I've seen the power of comparative oncology, both academically, scientifically, as well as very personally.
Mm-hmm.
Wow. Alice and our dad was diagnosed, I think it was around age 72, with cancer of the appendix, which is, I guess, very rare.
Very rare.
And we learned a lot, especially me not being a medical person, and ended up, he, in the end, it went to his liver, but he did experimental chemo at the Cleveland Clinic because we were fortunate to live there, right?
Sure.
He lived there. And, I wonder then, Alice, if any of that was...
But that was once it was in his liver. When he was first diagnosed, it was age 69, and I was a hospital pharmacist in a small community hospital. And our surgeon operated on him, and he told me, he said, Alice, if he'd have been at the clinic, Cleveland Clinic, they'd have closed him back up again when they opened him. He did a very extensive surgery, and he bought my father 11 years.
Yeah.
The last 3 of which it went to the liver, and then he was on the with Dr. Sandy Markowitz, the experimental chemo. But you're absolutely right, Dr. Post. That recent show on was it 60 Minutes about osteosarcoma? Wonderful. That was, and I know you guys you're funding that, if I'm not mistaken. Is that right, Barbara?
Right. So we had we actually funded some of Dr. Nicola Mason's originating work at UPenn in CAR T therapy. And that was featured prominently with Anderson Cooper in the 60 Minutes piece. Yes. And when she came to us, she was, in her proposal, she was really saying, I need niche funding here to start to gather the evidence that is going to prove to large institutional funders that this will be worthwhile. So Animal Cancer Foundation felt really strongly that this was worthwhile work to get that data on. So we couldn't be more excited than to see that it's moved down the years and the scope has gotten larger and larger. I believe she just finished a collaboration with the Parker Institute, taking that research even further. So you can see the bi-pronged way that we're trying to push things into the clinic on both sides. And I think about you, Alice, because I just had a dog who had malignant melanoma. So just thinking about the way that surgery and then the immunologics that helped him get a much extended period of time and quality of life. And that's something I think we always stress at Animal Cancer Foundation too, that veterinarians and veterinary oncologists are interested in the quality of life, not just extending the timeline of life. And that by researching in that area, quality, or what you guys would call toxicity of certain drugs, but I would call like getting to that lowest therapeutic dose that's effective, but doesn't have as many side effects or has zero side effect. Right.
Well,
So,
that, Barbara, that's interesting because I was going to bring that up with you and Dr. Post as well. I was just reading that in human medicine, they're taking a lesson from us in veterinary medicine and saying, hey, wait a minute, maybe we can reduce these chemo doses and not make these human patients so ill and focus more on QOL, quality of life, because Dr. Post, I know you would agree, the philosophy is different. We want that pet to have valuable, wonderful life in spite of its cancer, instead of trying to kill someone with the neutropenia that happens with chemo. But we cured his cancer, but he died from septicemia. So I think they're finally taking a lesson from veterinary medicine, at least in one aspect. Wouldn't you agree?
I absolutely would. And so you can't see them, but my rose-colored glasses are actually quite thick. I think that the best would be that both learn lessons from each other. In other words, human medicine learns our approach on really emphasizing quality of life, and we learn from humans the strive towards cure. So I think it's both. I think, the ideal situation is to treat pets and people with therapies that are the least toxic possible, but really aimed for cure.
Your furry friend's health and happiness is paramount. And while most pets are generally healthy, they may sometimes develop hyperkeratosis, a condition which is characterized by an excessive buildup of keratin proteins on the nose and paw pads, which causes the skin to become thicker than normal. Vetramax Solvacare Gel is a quick-drying, greaseless healing gel for the cracked skin of the nose and paws for dogs, cats, and even horses. With proper care, hyperkeratosis is highly manageable, and Solvacare Gel is the industry-leading treatment with ingredients like salicylic acid producing skin turnover and urea, which holds in moisture. This clinically proven patented formulation is the country's #1 veterinarian recommended solution for idiopathic hyperkeratosis. Vetramax Solvacare Gel takes less effort to yield maximum benefit. Today, our podcast listeners can try Solvacare Gel with an incredible 15% off at Chewy.com by entering promo code VetramaX15 at checkout. Order today at Chewy.com and save 15%.
Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems.
They make a food allergic diet that's an alligator-based called NP or a hydrolyzed salmon-based for dogs and cats called HF.
So please, ask your veterinarian about Blue Buffalo prescription diets.
And sadly, I think a lot of people, I mean, I deal with epitheliotropic lymphoma, skin lymphoma, as a dermatologist, but sadly, and I did have a dog with lymphoma, one of my rescues, a lot of people say, oh, I'm not putting him through that. And you really need to sit them down and kind of correct that and say, look, no. We want to buy him time and good time. It's hard to break through that.
It is, and that's a huge part of a veterinary oncologist's job is education, and as I think COVID uncovered with this access to care epidemic that we're going through, it's all veterinarians' challenge is education, whether it be about cancer or not, because again, if 6 million dogs and 6 million cats get diagnosed with cancer every year, there's no way all the oncologists in the country, there's 500 or so of us, there's no way that we're going to see that many dogs. And so if we truly believe and want that, as many dogs and cats as possible to be treated for cancer, a large burden of that is going to be treated by general practitioners. And so we need to give them the tools in order to address that reticence about treating animals with therapy for cancer, that cancer is not a death sentence, that we can, improve quality and quantity of life in many cases, not all, but many cases.
And I think that's where the mission of Animal Cancer Foundation is really so important, if I could expand on that, because part of our mission is to fund the research, but the other part is to increase the awareness amongst the general public about cancer and pet cancer and comparative oncology. So it's a lot about myth busting.
Mm-hmm.
And I think as pet owners, as we sort of turn out there, so often Animal Cancer Foundation gets a phone call from a pet owner saying, well, I'm not going, but it's interesting. It's before they've ever walked into their veterinary clinic and saying, I think this might be cancer and I'm not going to treat it. And, right there, before they've even stepped foot in a doorway to talk to a professional, they're speaking to their friends, they're speaking to an organization like ours. So I think it's really incumbent that we empower pet parents to speak to that there's hope for this, that you can turn around in the dog park and say, you know what, I hear what you're saying about not treating that, but I found out from an organization like Animal Cancer Foundation that you can successfully do this. And you might want to think about it some more and review what your options are before you make a decision.
And it's not always horribly expensive. I mean, right. if the oncologist, what they are aware of the pet parent's financial situation, there's options there. I just think a lot of pet parents think it's cut and dry. You do it this way or this way and forget it. No, we're here to work with you.
I absolutely agree with you. And, one of the things that we talked about, when I was in clinics was, the 3 costs of treatment. It's time, money, and emotion. And, it was incumbent upon us, not only me, but my staff as well, because, as soon as I left the exam room, my client would ask my technician, what do you really think I should do? And then when they went to the front desk, they would ask the front desk, what do you really think I should do? So it was really, to make sure that everybody in our practice understood how to communicate and educate, pet parents on, how to navigate those 3 costs. It wasn't just one. Somebody could have all the money in the world, but no time to bring their pet in once a week or however often. Or they could have all the time in the world and no money, or they just couldn't handle coming in that frequently. So there were so many different, scenarios that, we were happy to deal with. And, but again, it takes a village.
Mm-hmm.
think we're all jaded with our human friends who have been treated for cancer. And it's most of the time not a pretty picture, right? And you see them suffering, and you think, oh, I don't want my pet to suffer like that, because A, they can't communicate with me, right? And I learned a lot, Alice, with the other veterinary oncologists we had on, that the treatments aren't as intense with pets as
Right.
we are.
Very seldom do pets lose their hair, and that's a
Right.
big deal in humans. But very seldom do they. Yeah.
You know,
Yes.
and
To
so I
me,
think,
losing your hair, so what? But
yeah.
yeah.
But I think that's
Absolutely.
why humans are jaded that way when it comes to
I
treating
know.
with pets.
We're like,
I do.
yeah.
Yeah.
So, we like to think of it as how many more puppy kisses can you get? How many more times can you throw the ball in the field? How many
Right.
more times can you go hiking with your
Yeah.
pet? Guess what? You can. You can do all those things with the extension of time. And that's why we're all here, right? That's what we want.
Barbara, did you meet Dr. Post because of one of your pets having cancer? Is that how you all met?
It's a great question. And the answer is actually no. I met him in a more unusual way, but I think very relative to comparative oncology. So I had a lot of experience with a pediatric cancer and pediatric hematology in my own life. And someone we knew in common said, I think you two should meet, because I think there are some things you speak in the same language about. And they made an introduction. I was working, or I should say I was volunteering with Golden Rescue at the time. And my job with Golden Rescue was to review medical bills for the organization. And so I would say early on, not dating myself, but early on, I realized something was going on with golden retrievers when it came to cancer. And that was another thing that made me want to take the meeting, was just to be able to ask my questions about that from a board certified oncologist. And I went in and I took the meeting saying, well, what about this? What about that? And when I heard about this idea that Dr. Post is talking about sharing information across species, about the One Health idea, it was like I was gobsmacked. And I said, you mean this is not going on? I mean, we're not doing this? You've got to be kidding me. Okay, I'm on board. Like, show me what to do, because I really believe this is going to be life-changing.
I don't know why it took so long for the One Health aspect to take effect. I mean, when you think about it, we could only learn from each other. It amazes me that it didn't exist like when we all started in the 70s and in the 80s. It really didn't, sadly.
It didn't. And, my other career is I'm a conservation biologist. And so the One Health, paradigm really resonates with me. Not only, animal health and human health, but environmental health as well. They're all related. And the more we learn how more and more interrelated they are. And so it's a fantastic concept. And I really applaud those people who have championed that cause over the last, 10, 15 years. They've just done a really fabulous job in terms of elevating it and making sure people understand what the One Health concept is.
Janet, why don't you tell Barbara and Dr. Post about your conservation wildlife story that just happened a few days ago?
Which particular one? Because I have a couple.
The 10-foot one. The 10-foot.
Oh, so I was just down in Sanibel visiting Alice with my husband and son, and it was about 8 o'clock at night, and we're driving. It's dark. There are no lights on Sanibel.
And the whole island at 8 o'clock closes down. You can't get anywhere to eat it after.
There's no partying.
Love
It's bad. Yeah. So we're driving back from dinner, and this car, there's no other cars. This car is stopped on the side with its lights ahead, and it's pitch black. And we're like, what is going on? That's kind of weird. I hope they're okay. And we start to pass, and there is an alligator that is 10 to 12 feet long. I'm not exaggerating. Black in color and super shiny wet. So clearly it had come out of water over here and was crossing the road. And we're just like, whoa. And my husband's steering the lights and putting the brights on. And my son has got the video going, the whole thing happening. So as we passed the car that's video, I said, excuse me, we're going to be in your shot. And this woman's in there going, can you believe it? Oh my God. And she's got like rock and roll music on in the car. So we passed that car and my husband goes, they're kind of following us. They're turning down our street. And lo and behold, I said, I think it's Angela, Alice's neighbor. And so I said, Alice, text Angela. Is that her? And sure enough, it was her. And she sent a video and she goes, wait till the end. And you see a coyote, like to the left of the gator. Because I thought gators did like this. Do you know what I mean? I think it was that. And I was telling our producers before, their legs are like this. And then they go out. And that thing raised up like 3 or 4 feet.
Raised up pretty tall.
Lincoln Motor. So I actually just Googled before we came on. And that gator was like 40 years old.
Oh.
Yeah.
Okay.
10 to 12. It was so that. And then we saw 3 coyotes that just looked like German shepherds walking down the street in the daylight.
But that's one of the reasons that we love Sanibel, because 2/3 of it is a nature preserve. Yeah. The whole idea is you can live here, but you need to respect what truly lives here. Yeah.
And we saw, this is the most, I've been going to Sanibel, for some, 20 some years. This is the most nature I saw.
Yeah, but I think 3 hurricanes will kind of stir that up.
Right.
Yeah, stir the pot. Yeah. It was really, I've never seen an alligator that big, active like that. So that was kind of cool. But in my own home, I'm going to, people don't like this, but we have 2 cats that we call, in again, out again, because they go in, out, in, out, in, out. So we probably should keep like a kill chart. The whole reason we got them is because we have a old stone wall, and there's chipmunks everywhere. So yesterday's kill chart was a mouse. And then last week there were 3 flying squirrels, which I'd never seen before.
Aww.
Sorry. It's the circle of life.
Yeah. Okay.
And they love it. They're happy. They don't eat them. They just.
I love what you said, Alice, about Sanibel Island, in that, you can live here, but you have to respect who really lives here. I think that's wonderful. Here in California, most of our neighbors are really excited, when there's a coyote or, some other deer. Because it's their world too, and it's so lovely to know that we share the world with such magnificent creatures. Just knowing that they're out there makes my life fuller and richer.
I came from an education background originally, and I would say that as children get more and more distant from wildlife and wild animals, if we have more of them living in urban atmospheres, then it becomes incumbent upon all of us too to teach that and teach those One Health concepts and to expose them to all of these ideas so that we're bringing up the next generation to understand. I heard a researcher in conservation say the other day that if you go into an elementary classroom and ask them to list 10 wild animals, a lot of classrooms, there's difficulty to do that.
Well, and I think you're right. And I think to teach them respect too, to respect wild animals. You don't go up and want to pet every animal you see. That's a wild animal and they're different from your cat or dog. And we need to respect that. Yeah.
Yeah. I'd go further and say, don't approach the dogs and the cats without.
Unfortunately, because of COVID, some of those younger kids had very little exposure to other humans.
True.
Other than their family. And so that's even an issue now too, their comfort level interacting with others. It's a little scary. So.
Your furry friend's health and happiness is paramount. And while most pets are generally healthy, they may sometimes develop hyperkeratosis, a condition which is characterized by an excessive buildup of keratin proteins on the nose and paw pads, which causes the skin to become thicker than normal. Vetramax Solvacare Gel is a quick-drying, greaseless healing gel for the cracked skin of the nose and paws for dogs, cats, and even horses. With proper care, hyperkeratosis is highly manageable, and Solvacare Gel is the industry-leading treatment with ingredients like salicylic acid producing skin turnover and urea which holds in moisture. This clinically proven patented formulation is the country's #1 veterinarian recommended solution for idiopathic hyperkeratosis. Vetramax Solvacare Gel takes less effort to yield maximum benefit. Today, our podcast listeners can try Solvacare Gel with an incredible 15% off at Chewy.com by entering promo code VetramaX15 at checkout. Order today at Chewy.com and save 15%.
Blue Buffalo Natural Veterinary Diets offer a natural alternative in nutritional therapy. With their in-house research and development team with over 300 years experience in well, pet, and veterinary therapeutic diets, more than 600 scientific publications, and more than 50 U.S. patents. Blue Buffalo Natural Veterinary Diets.
But
No.
Janet, I wanted to ask Dr. Post about PhytoCure. And Dr.
Yeah.
Post, can you, because I have to tell you, when I hear the word genome or genetics, I kind of start to get tremors. So can you put that?
As a layman, I go, wait, what was
Well,
that?
that's what I was getting to. That can you kind of put that in language that we could all understand? Because I think it's a wonderful concept.
Sure. So it's this comparative oncology concept that started it. In other words, we know from, since 2000, when the first human genome was sequenced, the importance of genetics to cancer, whether you're talking about cancer biology, cancer diagnosis, the development of cancer therapeutics. We know how important that has been in humans, and we know that, targeted therapies that target the specific genetic alterations that occur in cancers, how effective that's been in human oncology, whether you're talking about small molecules, whether you're talking about monoclonal antibodies. And so what PhytoCure did was really commercialize the sequencing of dog tumors and the matching of those mutations that we find to small molecule therapies or therapies in general. And so it really, again, opens that toolbox to allow people whose pets have cancer more options. And, as a clinician, that's incredibly important. So not only are we giving people more information about their pet's cancer by looking at the genomics of the cancer, the genetic code, because that often can tell us information about how bad the cancer is, sometimes what the cancer is, the prognosis, and it can also give us information about what therapies may be more or less effective in that particular cancer because of the genetics. And then PhytoCure also said, just having that information is not good enough. We need to be able to act on that information. And so therapeutics were brought in from the human side to address that need of intervention. When we find an issue, okay, knowing it's great, but here's what you can do about it as well. And we started with small molecule inhibitors, which are inherently easy to use in dogs and cats because they're oral. They can be given at home. You don't have to bring them to the oncologist or to the vet for repeated infusions. And people have experience with these drugs already. Alice, Apoquel is one of these types of inhibitors, small molecule inhibitors that can be quite effective. My two Frenchies are on Apoquel. I was involved with one of my colleagues, Shore London, bringing Palladia into the veterinary market. And so, again, these are drugs that can be given at home. if an animal develops toxicities to them, they're fairly easy to address because unlike an injection or an infusion, you can't take that out. With small molecules, you can give them a drug holiday. You can stop the drug. You can reduce the dosage. And so the how you fix toxicities is much easier than it would be for traditional injectable chemotherapy. And so again, back to the beginning of what we were talking about, allowing veterinarians to treat cancer in a way that gives the pets higher quality of life is important. And again, when you look at those 3 different costs that I talked about, giving people other options besides radiation therapy, injectable chemotherapy, what have you, is always a good thing. And so, when I moved out to California, PhytoCure, I was originally a client of PhytoCures and an advisor. And so I saw firsthand the value of this approach, genetics and targeted therapy, to both my patients and to my clients. And so when I moved out to California, they asked me to be their chief medical officer, and it's been an absolute joy ever since.
Wow. So Alice, I've got to ask our question. So
but before you ask the question, I just want to say something to Dr. Post, and I'm so proud that veterinary medicine had the first JAK inhibitor of Apoquel even before human medicine.
They did.
Interesting.
They did.
And it's relatively inexpensive.
Correct.
Yes.
Correct. One of my dogs is on it every day.
What is the drug for?
Allergy.
Apoquel is
amongst
for
other things too, but yeah, it's approved.
Because I've heard you say it multiple times, but I really don't know what it's for.
Because you don't have an allergic golden. Lucky you. Barbara, I can tell, has heard of it.
What she's allergic to is not throwing the ball enough.
So I have experience with one of my Frenchies with both a small molecule inhibitor and a monoclonal antibody. So one of my Frenchies is on Cytopoint as well as Apoquel.
Mm-hmm.
So again, I speak about these therapies as not just scientific endeavors, but from a very personal perspective. They work.
Are your Frenchies related?
They are half brothers. Yes.
Oh. So it's Henry and who?
Henry and Louis, French kings.
That's adorable. So we ask each of our guests, what is your pet peeve? And it can be about a human peeve or it can be about animals. So Barbara, what's your pet peeve?
With my Animal Cancer Foundation hat on?
No, just your human, everyday Barbara hat on.
With my Barbara hat on, I wish everyone was reading books more.
Yes.
Oh, our sister's a librarian. So
I see. I have common interests with the entire family.
You too.
You do.
And Barbara and I have been emailing each other. Honest to God, it's like she's our third sister.
Oh,
Golden,
Well, thanks for that.
books,
Yep.
historical preservation, and
I
she's
love
an
historical
English
preservation.
teacher.
oh wow.
I was.
And
I say,
you're from Long
I
Island.
say a recovering English teacher.
Oh.
Do you live on Long Island? Barbara, you're on Long Island, right?
Yes, that's right.
I'm just across the sound from you.
Oh,
I'm in
okay.
Connecticut. I'm near Stamford.
You're a neighbor.
I'm a neighbor.
You're a neighbor.
I'll make-
That's my thing. Ever since social media came along, my big thing is that I think we get something from reading and from books.
Yeah.
that
And
we
I like
don't
holding
get.
the book,
Yes,
and turning the pages. I love that.
it's tactile.
Is everyone, I don't know if it started with those top 10 lists, but everyone's attention span is about like this now,
Yeah.
right? Like, just give me, like, what are the high points?
The
You know,
clip
like,
notes,
I
the
want to
clip
tell you
notes.
my story,
Yeah.
right? Yeah, a little frustrating.
Right. But if we want to, understand things as maybe complicated and as simple at the same time as monoclonal antibodies.
Yes.
Dr. Post is talking about, right? Like all those big words. The way in is through reading and explanation
Yeah,
and time. So, like he said, that great commodity of time.
totally
Just
agree.
there's my pet peeve, folks. We have to read books.
We have to and read. Honest to God, read signs like "Do not park here." Really
Oh,
easy
yeah.
to read. Fire lane, right?
Yeah, those
Really
are
easy to-
super simple.
Literally, I was parked yesterday, and there was no spot next to me. And it's New England, so the spots are like this, and the stores are right here. And the woman next to me pulls in, and I realized, oh, middle school just got out. There's no parking space, and she parked in front of the Dunkin' Donuts or whatever it was, and the three kids jumped out to run in and get their big pink drink, right? And I was
All
like,
sugar.
not even in a spot.
Well, the mayor of the village that I volunteer for always says, "That's the who's better than me attitude. Who's better than me? I just
I live in Fairfield County, Connecticut. Everybody's better than me.
Everybody's better than me, and at my age, I don't care.
Yeah.
I'm right there with you.
Dr.
Are you-
Post,
And
we need to hear Dr. Post's pet peeve.
Yeah. What's your pet peeve?
Sure. So it's similar along the same lines.
Yeah.
I really think the focus on education needs to be much higher. And I don't just mean formal education. I just mean learning in general.
Yeah.
I wish there was a stronger focus on learning. There's at least for me, there's a joy that I get from learning and from finding out things and from experiences that I think could be more cultivated in our country.
One last thing.
Oh, go ahead, Jan.
No, one last thing before we wrap up. In terms of fundraising, Barbara, do you have like an annual event that our listeners might be interested in?
And we have to put a link for
We will, for
yeah,
sure.
for the Animal Cancer Foundation and PhytoCure on the podcast.
Thank you.
So we are really focused on May being Pet Cancer Awareness Month.
Makes sense. Yep.
Right. And we're going to roll out a series of things that folks can engage with. And that might be corporate folks who are supporting us and inviting in participation. That might be them being able to do a variety of activities and things that will help to raise money. But a large tail event, no. We have a variety of third-party events going on around the country, and folks can check out the website to look at that.
Great.
Yep.
Because Janet, that's really the only thing as a veterinarian that I do socially is, and Janet comes to some of those with me, is go to animal cause fundraisers. Right. Because why not? I mean, I can have a good time and the money goes to a good thing. Right.
And we have done things like walks and things of that nature in the past. We've had a great relationship with Central Bark, which is right. And they've hosted parties and benefits, and that's allowed us to get out across the nation.
Good. In
locations that are good for people to participate with us.
Barbara, you'll love this. Janet and I set up our Speaking of Pets podcast at Golden Fest 2024 here in Fort Myers, which drew 5,000 Golden Retriever pet owners and just all dogs of every kind. And we got a lot of shopping done, didn't we, Janet?
We got a lot of shopping done, and I've never seen so many Golden Retrievers in one place. And it was really lovely. Some of them dressed them up. Some of them have that coloring on, like they dyed.
But the best thing was the Calendar Girls, which is a group of senior citizen women that do a kick line.
like the Rockettes in slow motion.
But turning was a big deal.
R-E-S-P-E-C-T.
Yeah. I thought you were going to tell me that it was a kick line of Golden Retrievers.
No.
I was really...
But I do have to say, there was a lot of patient education going on there.
It was great.
Because they would come in and I did a thing called Ask the Vet. And of course, it was all about allergy, my dog's itchy, blah, blah, blah. But there again, we dispel a lot of myths. And that's the whole reason for this podcast. I just got so sick after I retired of people getting misinformation online.
Mhm.
And I said to Janet, we've got to do this. We've got to get specialists on to give the correct information, evidence-based, accurate information. And it's still a fight. People still want to listen to their neighbor.
Yeah.
Right. Which is why we have
Well,
to educate the general public, right?
Yeah,
It's why
we
we
do.
have to be out there, and you are with that messaging, and that makes me think of my pet peeve for Animal Cancer Foundation.
Yeah.
Is that folks can't be empowered if they can't access the right information.
They've got to have the knowledge to
They
make a
can't
good
be.
decision. Right.
well,
Yeah.
thank you so much for doing what
That's
you're
right.
doing.
And
Things like for us going to Golden Fest, we had so many more followers after that weekend. It was unbelievable. So getting the word out has been really rewarding. And me as an average pet owner, not a physician, I've learned a lot through our guests. And
I have too, Janet. I have too. Yeah.
it's really, and everyone has a personal story, which, is
And a
something
pet
I
peeve.
learned.
And a pet peeve.
And a pet peeve. It's
Indeed.
also really heartwarming to see what motivates individuals to do the good work that they do.
I
So,
love Dr. Post's inspiration for starting the Animal Cancer Project. That's touching. Thank you
Thank
so
you.
much.
really cool.
Thank
So
you.
thank you both for being on. We'll put your website up on the site. Our producer will
Absolutely.
take care of that. And we hope to have you on again. Would be
In
great.
May, so we can promote
Yep.
the Cancer Month.
Well, we'd have to do it before May to launch
Right.
it in.
Yep.
we would love to do that.
Yep.
And maybe some of our other board members can join us at that time and talk about how they got involved. I think that would
Would
be
love that.
terrific.
Great.
And Barbara, send us some pictures and Dr. Post of your pets so we can make them the perfect pet of the week.
I think I can find a
Yes,
few.
they get a following then.
Well, those two Frenchies are coming in and out of that room, and it's all I see.
I
are
know.
ears.
I know. Like, what's going on? What's going on?
People are like, I'm on a mission. What's Dad doing?
This is important stuff to do.
I'm a
Indeed.
little concerned because while we were taping, I heard noise downstairs, which is where Libby is. So I'm dying to know what was going on there.
Oh yeah. Mine are sleeping, so we're good.
Well, thank you so much. It's been a pleasure. And thank you, listeners, today for tuning in. I hope you learned something. I certainly did.
Yes. Hey, this is Dr. Alice Novotny-Jeroman from Cleveland, Ohio, and
Janet Novotny King, also a Cleveland, Ohio native, saying thank you for listening, and we appreciate you. Take care. Bye.
bye.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts because we love to have those likes. Thanks so much for listening.
That's actually really good. You could both go bye-bye.
Bye-bye.
Yeah.
How about woof woof?
Speaking of Pets podcast has been sponsored by Vetramax Solvacare Gel, the industry-leading treatment for idiopathic hyperkeratosis. Available from your vet or visit chewy.com to save 15% with promo code VetramaX15 at checkout. Vetramax makes it better. And Blue Buffalo Veterinary Diets. Love them like family, feed them like family.
Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.